I'm Sarah Moon, she, her, and I'm with the morning online check-in group. Recovery College is learning to deal with life in an effective and honest way. I've been with them for a couple months now, and I think it's been really important for me personally because it's allowed me to socialize, because I've had a difficult time, especially during the past 2 years, of course. It's allowed me to learn some really effective coping techniques, especially with anxiety and whatnot. Mental health is health. It's part of the physical health. The brain is just as physical as every other organ in the body, every other system, and we need to treat it as such. This is the type of thing that works for people, is that peer support. It's like going for a peer support group for people with cancer or another condition. This is no different. This is just as essential, and we need to continue funding and having access to these services for all folks.
My name is Alma Abels. I am from Radir, originally from Europe, Bosnia and Herzegovina. When I started working here in Canada, I noticed that it was a different feeling. It was different culture at the workplace. And I was researching on the possible courses that I can take, and I ran into the course that I was taking with you guys. We are all the same. We are all in the same group. We all have a power to make the changes. And there is so many resources that I wasn't even aware that they are up there. And there are people that I can rely on that I met through this program. This course gave me really some another point of view and different directions, and put a smile on my face, that's for sure.
My name is Trudy, last name Dover. I'm a support group leader for Edmonton. People that are showing up, we have everyone. Anyone who's on the front line and who is dealing with trauma and is dealing and is looking for a safe place to belong, to connect, to have encouragement and support. Peer support in general has saved my life. I wouldn't be sitting here if it wasn't for that. We're about recovering from trauma and post-traumatic growth and learning how to, because PTSD doesn't go away, but it's what you can do is you can learn to live with it and get better, and to create a better environment for yourself so that you can thrive afterwards. And that's what this group is about.
My name is Diane. I attended Caregiver Connections as a participant for about 3 or 4 years. When they needed another facilitator, I stepped into that role. So now I co-facilitate our local group of Caregiver Connections. Based on my own experience, when I found out about it, I felt like I had looked under every rock in my city, trying to find some sort of help and guidance to dealing with a loved one with mental health issues. And without that support of the group, I really don't know if I would have made it. We're giving out a lot of ourselves, and we need somebody else to help us fill it back up. Caregiver Connections has empowered a lot of people. We understand, I think that's one of the most important things, is non-judgmental, understanding, support, and care.
My name is Donna George, and I use she, her pronouns. I've been a Health Campus Alberta member for 8 years, 2 years at Mount Royal and 6 years at a previous post-secondary institution. And I think what's really beneficial about Healthy Campus Alberta is that it's a unifying force or a hub for post-secondaries in the province. I've really appreciated about Healthy Campus is that they've created such a warm, engaging and welcoming, inclusive space for staff, students, and faculty. And again, I always felt my voice was important and valued. And they've supported all of our activities. They've supported our research activities, our workshops, They've included us in any kind of advertising that we've requested. So just really appreciated their support.
My name is Michael Green. My pronouns are he and him, and I'm the Learning and Resource Coordinator for our Integrated Youth Hubs team. I've been involved with the Youth Hubs team for about 3 months, but my work with the project goes back even further, back to 2018, where I joined the steering committee for one of our Youth Hubs before it opened. So I've been involved with the Youth Hubs project overall for about 4 years now, and I think that the work it does is both landmark for the province as well as just so needed for so many of our youth. I've gotten the fortunate ability to work with many youth over the years, and so much of what their needs aren't answered by the existing systems. A lot of the work of hubs that I've seen firsthand is that youth are seeing pathways towards mental wellness that they didn't necessarily have before, but the hubs actually bring these services and these supports and these things that the youth need directly to youth, and then go the extra mile to make them accessible for youth. So it's not just presenting them with the option, it's making those options safe for the youth to access to begin with.
My name is Pearl Lorenzen. My pronouns are she, her, and I am an animator with the Rural Mental Health Network. I think rural mental health has a lot of extra challenges, and I think because smaller places, community is so important. So having a community-led initiative such as the Rural Mental Health Network is really, really important. Thinking about that idea of that listening and being connected. And I think that's one of the things that a community initiative can do. It doesn't have to be clinical. It doesn't have to be complicated. It's just finding ways to allow people to connect. And so that's something I think that I really appreciate about the Rural Mental Health Network is how intentional everyone is in being available and really listening and just being encouraging. I think it's a very encouraging environment.